Welcome back. If it's your first time here, welcome. We are going through a lecture series to learn a little bit more about the brain. So, anti-anxiety medications, you may have heard of them. What are they? What are they used for? How are they used? And what exactly is happening in the brain? As you can see from the image, there are two main areas. One is the prefrontal cortex, which we've already discussed in prior videos. The amygdala, which you may have probably have heard before at some point in time, is a very important area of the body that is sort of the overall system that is trying to understand danger. When someone is in anxious situations, the amygdala is firing. It is overly responsive. So for anxiety disorders, there's a decrease in activity in the prefrontal cortex. Now, in general, when you look at some of the definitions of anxiety, what you're going to come across is people or patients feeling very overwhelming, anxious feelings that are affecting their daily life. You're having two systems that are kind of off balance, right? A few different ways to help someone with anxiety is to try and help them think through some of their fear. This is where cognitive behavioral therapy is really useful because we can teach coping skills and mechanisms to think through that anxiety, to question that anxiety, to figure out what cognitive distortions or thoughts are happening that are exacerbating that anxiety. What we're trying to do is that we're trying to increase the activity of the prefrontal cortex in order to downregulate some of the activity of the amygdala. Typically, treatments for anxiety disorder consist of a combination of medication and therapy. But what we're trying to do is that we're trying to increase the production of certain types of neurotransmitters in the synapse. And when we increase this level of neurotransmitters in the synapse, the brain is therefore able to utilize those neurotransmitters in a way that can produce some positive benefits for the patient. Some version of these anti-anxiety medications are called SSRIs, right? Selective serotonin reuptake inhibitors. What they're trying to do, right? So they're increasing the production of serotonin in the brain by blocking the reuptake of serotonin in the neuron. So now there are some side effects of SSRIs, and that can include jitterness, nausea, restlessness, headaches, fatigue. You can imagine if there is a flux or an overproduction of serotonin that is now in this space, that means that the person might start to feel a little bit overly excited or overly jittery. They inhibit the reuptake of serotonin by binding to that SERT, S-E-R-T protein, and this blocks the serotonin molecules from re-entering the neuron and keep serotonin molecules in the synapse even longer, right? This actually then is improving the signal between the neuron and enhancing the effect of the serotonin. Okay, now another version of some anti-anxiety medications are SNRIs, right? So these are serotonin and norepinephrine reuptake inhibitors. These are also used to treat depression and anxiety as well. Typically, what you're going to see psychiatrists do is that they'll typically use SSRIs for just typical depression or anxiety. But if someone is a little bit more resistant to that medication, then they might try an SNRI. So as the name says, it's going to increase the production of serotonin as well as norepinephrine, and it's going to block the reabsorption or the reuptake of both the neurotransmitters from binding to both the SERT and the norepinephrine transporter. And then therefore, you're going to get an increase or a flux or production of serotonin and norepinephrine in that synaptic cleft or in that space from the presynaptic cell to the postsynaptic cell. Some side effects of SNRIs you can imagine are going to include some of the same things from SSRIs, being jittery, nausea, restlessness, sometimes having a headache, or even being fatigued. The last thing that I want to talk about is tricyclic antidepressants. So you may have heard of these as well. There's a lot of different ways to treat depression or anxiety, right? You have the SSRIs, you have the SNRIs, and then you have the TCAs or the tricyclic antidepressants. So these are really effective drugs. They're typically not used on a sort of a first priority basis because they do tend to have a lot of side effects, more so than the SSRI or the SNRI, but they do tend to be a second-line drug next to the SSRI. They work kind of like the SNRIs by blocking the reabsorption or the reuptake of both the serotonin and the norepinephrine. They're binding to that SERT and NET transport protein, and then therefore by binding to those, they're preventing the serotonin and norepinephrine from going through those transporters and then therefore being released or increased or fluxed into that synaptic cleft. Now, the other thing that TCAs do, other than serotonin, increasing serotonin and increasing norepinephrine, is that they also increase dopamine. Side effects of TCAs are also very common with SSRIs and SNRIs. You're going to perhaps experience some dizziness, headache or migraines, maybe even some cardiovascular complications. TCAs, as I mentioned, are second line for a reason, because they do tend to have some side effects that produce some cardiovascular complications. Think about these medications increasing either serotonin, norepinephrine, or even dopamine in the synaptic cleft. So that is anti-anxiety medications. Hopefully that was helpful. The next thing that we're going to discuss and talk about is going to be antipsychotic medication. And so with that, I will see you there.